Concussion and headache are very closely related. With regard to patients after they've sustained a concussion, depending on which study you look at, it's been reported that as many as 94% of patients after concussion will have the symptom of headache. So it's very common. And migraine or migraine type headaches and concussion are also very closely related from a pathophysiological standpoint. When you think about migraine, that is typically caused by a release of certain inflammatory proteins or inflammatory markers into the bloodstream. Now, in the world of concussion, after an individual's sustained a head trauma, you also will similarly have that release of inflammatory markers or inflammatory proteins in the bloodstream. So the two conditions are very similar in that respect and often go hand in hand.